Welcome to Chapter 10, Part 3. In Part 2 of Chapter 10, we began introducing many different tables that included muscles as well as their origins, insertions, and actions. Those muscles belong to the head, the neck, the vertebral column, as well as the thorax. In Part 3 now, we will study muscles of the upper limb being the shoulder, the arm, the forearm, as well as the wrist and hand. The format will be the same. You will see many different tables with the muscle name, a brief description, origins and insertions, as well as actions. Again, maybe pause the PowerPoint when you reach an image and try to identify the muscles that we have discussed up until that point. The first group of muscles that we will begin to discuss will focus on the shoulder joint. There are 9 muscles to be exact that cross the glenohumeral joint. That means 9 muscles pass where the glenoid cavity articulates with the head of the humerus. All of these muscles will help to stabilize the shoulder joint, but also to move the arm or the humerus. These muscles will insert onto the bone of the arm, known as the humerus. Certain actions that we will see include flexion, extension, adduction, as well as one that's not listed here, abduction. We'll start by talking about 3 prime movers: pectoralis major, latissimus dorsi, and deltoid. After those 3 prime movers that we'll see on the muscle table coming up, we will move into the rotator cuff. Now, when we learned joints, we identified these 4 muscles, but now you have to know their origin, their insertion, as well as their action. Either way, all 4 of them form a cuff around the shoulder joint capsule to help further prevent shoulder injuries such as dislocation. 2 more muscles that are synergists to the above 4 include coracobrachialis and teres major. We'll first start by talking about the 3 prime movers of the shoulder joint. These are larger muscles that are capable of producing greater force than the 4 muscles that comprise the rotator cuff. The first being the pectoralis major muscle. This was briefly mentioned in Chapter 10, 4, along with pectoralis minor. But again, pectoralis major is an example of a convergent muscle that originates from both the clavicle and the sternum and inserts onto the intertubercular groove of the humerus. Again, with actions, see if you can palpate the muscle and perform the action to feel the muscle contract. The pectoralis major is going to adduct, medially rotate, as well as flex the arm at the shoulder joint. Again, the arm is shoulder to elbow. Next, we have deltoid. The deltoid muscle forms the contour of the shoulder, and it is shaped like a triangle. It's a great example of a multipennate muscle when looking at fascicle arrangement. The deltoid's origin is the same as the insertion of the trapezius. The deltoid comes from the acromion as well as the spine of the scapula and the clavicle. The deltoid will taper and come to a point where it will insert onto the deltoid tuberosity of the humerus. The deltoid is the only muscle capable of flexion and extension of the arm at the shoulder joint. It is also able to produce abduction, as seen in a lateral fly if you were to lift weights. Lastly, latissimus dorsi is referred to as the swimmer's muscle. It's a broad and flat muscle that comprises much of the lower back, and it is also superficial. It's coming from thoracic and lumbar vertebrae, as well as the iliac crest. The latissimus dorsi will also insert onto the intertubercular groove near the pectoralis major. They call it the swimmer's muscle because individuals who swim competitively have a more defined latissimus dorsi. They have a wider back. The latissimus dorsi also helps to produce the swimming motion, which is arm extension, so moving your upper limb posterior, medial rotation of the arm, as well as adduction. Here on this slide, you should take a moment to identify the last three muscles that we discussed: pectoralis major, deltoid, and latissimus dorsi. Also take a moment to identify each of their origins, insertions, and maybe try their actions on yourself. On the left side, we see an anterior view of the right upper limb. Take a moment here to identify the pectoralis major on the anterior thorax, as well as the deltoid on the shoulder. In the image on the right now, a posterior view, take a moment to identify the latissimus dorsi, forming much of the lower back. On this table, you will find all of the details about the four muscles that make up the rotator cuff: supraspinatus, infraspinatus, teres minor, and subscapularis. Remember, teres minor belongs to the rotator cuff. Teres major is not included in the four. All four of these muscles, well, except for teres minor, are named based on their location on the scapula. For example, supraspinatus. That muscle will originate in the supraspinous fossa on the scapula. It's that depression above the spine on the posterior aspect. Supraspinatus will insert onto the greater tubercle, along with two other rotator cuff muscles, to produce abduction of the arm. You should keep in mind that the deltoid also produces abduction. Supraspinatus initiates abduction. It gets it started. It helps to lift the arm up and out to the side, and then deltoid takes over. Infraspinatus now originates from the infraspinous fossa, the depression below the spine on the scapula. Infraspinatus also inserts onto the greater tubercle, but it's involved in lateral rotation of the arm. So think about twisting the humerus out away from the midline. Next, teres minor. Similar to infraspinatus, again not named for any position on the scapula, comes from the lateral border of the scapula and also inserts onto the greater tubercle, assists infraspinatus with lateral rotation. And lastly, subscapularis lies deep to the scapula within the subscapular fossa, and it is different from the other three in that it inserts onto the lesser tubercle now, and it medially rotates the arm. Two more muscles that help with movement at the shoulder. Here on this image now, we are looking at a posterior view of the shoulder and the upper limb. First thing you should do is identify the four muscles that form the rotator cuff: supraspinatus, infraspinatus, teres minor, and one that you're not going to be able to see because it is deep to the scapula, subscapularis. While you're also here, you can identify teres major. However, you are not going to be able to see coracobrachialis because it is located anterior to the shoulder joint. Now we will begin to move distally along the upper limb, so away from the shoulder and into the arm. The upper and lower limbs are similar to houses. Houses have rooms. Rooms are surrounded by walls. And what I mean by this is that we have compartments in the upper and lower limbs. Muscles are grouped together in compartments, and usually they share similar origins, insertions, and actions. In the arm, there is an anterior and a posterior compartment. There are 3 muscles in the anterior compartment of the arm and 1 muscle in the posterior compartment. The 3 muscles in the anterior compartment of the arm include the coracobrachialis, biceps brachii, and brachialis. You saw coracobrachialis a couple of slides ago, so we will move on from there. The biceps brachii muscle, its name suggests that it has two heads or two origins, and it is found in the brachial region of the body. The biceps brachii has a short head and a long head, two origins. The short head of the biceps brachii comes from the coracoid process of the scapula. The long head comes from the glenoid cavity on the scapula within the shoulder joint capsule. Both of those heads fuse together to insert onto the radial tuberosity of the radius. Now, usually we think of the biceps brachii as a forearm flexor or flexion at the elbow, but the biceps brachii is an extremely strong supinator. Remember that supination occurred at the forearm. It's when the radius rotates about the ulna to produce palms up. Think more soup, please. The biceps brachii primarily functions to produce supination and assists with flexion at the elbow. Brachialis is a little bit further down the humerus and deep to biceps brachii. It originates on the humerus and inserts onto the coronoid process of the ulna. This is the primary forearm flexor. This is the strongest flexor at the elbow joint. Now we're going to switch gears briefly here and talk about Brachial Radialis. Again, its name tells you its origin and insertion. Brachio means that this muscle originates on the humerus. Radialis means that the muscle inserts onto the radius. So this muscle is not in the arm, but it does cross the elbow joint. This muscle is found in the forearm and produces flexion of the forearm or elbow flexion. The one muscle in the posterior compartment is the triceps brachii. Tri means three heads or three origins: a long head, a lateral head, and a medial head. The long head crosses the shoulder joint to originate at the glenoid cavity. The lateral and medial heads both originate from the humerus. All three heads fuse together for a common insertion point at the olecranon of the ulna, or your elbow. The triceps brachii extends the forearm. On this slide, take a few minutes to maybe pause and find two of the three muscles in the anterior arm and the one muscle in the posterior arm. From this view on the left, you are able to see the biceps brachii muscle. Again, you do not see its two origins because they are deep to pectoralis major and deltoid, but you can see the two heads fused together for a common insertion point in the forearm. Deep to biceps brachii, you are able to see brachialis. You are not able to see the third muscle of the anterior arm, coracobrachialis, in here entirely because it is much deeper and more proximal than the other two. Looking at the other image now, the posterior arm, you are able to see the triceps, its three heads, as well as its insertion point. Going back to the anterior view, you are able to see a portion of Brachial Radialis. However, it is found mostly in the forearm, so be on the lookout for it in a few slides. Moving into the forearm, remember forearm is elbow to wrist. A lot of these muscles will cross the elbow joint, and they may also cross the wrist joint to produce movement of the elbow, the wrist, the fingers, and the thumb. We will see flexion, extension, abduction, adduction, in addition to pronation and supination of the forearm. Remember, the biceps brachii muscle was the prime supinator of the forearm. But we also have a couple of muscles that will help with pronation and supination. The main pronator in the human body is known as pronator teres, and a muscle that is synergistic to biceps brachii is supinator. Similar to the arm, the forearm is divided into an anterior and a posterior compartment. Muscles that are found on the anterior forearm usually have the term flexor in their name, and muscles that are commonly found in the posterior compartment of the forearm usually have the term extensor So starting with this table here in the anterior forearm, we have pronator teres. I would mostly focus on the function or the action of these muscles. And lucky for you, the name usually tells you what it does. Pronator teres will pronate the forearm. Flexor Carpi Radialis. As soon as you see flexor, you should think flexion, anterior forearm. Carpi means wrist or the carpal region. Radialis tells you its location on the forearm. It's on the radial or lateral side. Flexor Carpi Radialis will cross the wrist joint to flex the hand or to flex the wrist. Palmaris longus. Sometimes this is absent in people. Some people are just born without it. It is there to tense the skin and the fascia of the palm. So think about bringing all of your fingers together. Next, flexor carpi ulnaris. It is also going to flex the wrist. Lastly, flexor digitorum superficialis. Now, this muscle will insert onto digits 2 through 5. Notice I did not say digit 1 or the thumb. Flexor digitorum superficialis will flex the 4 fingers or flex digits 2 through 5. Both images seen here are from the forearm, more specifically the anterior forearm, where we will find a lot of flexors. The one on the left is a more superficial view. Again, muscles occur in layers. Image B, seen on the right, has those superficial muscles removed to expose deeper muscles. Again, take some time to identify the muscles as well as their actions. From the left view, you are able to see the majority of the anterior forearm muscles like pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. Now, if you remove those ones, you are able to expose the other one that we discussed, flexor digitorum superficialis. On the right, you are able to see that muscle produce 4 tendons to insert onto the digits. In this muscle table, you will find 4 muscles that are found on the posterior forearm, or extensors, either extensors of the wrist or extensors of the fingers. The first one, extensor carpi radialis longus. This one will extend the hand at the wrist joint, and it is found on the lateral forearm, hence the term radialis. Similar to this muscle, we also have extensor carpi radialis brevis. Brevis means short. This one also functions to extend the hand at the wrist joint. Extensor digitorum. As its name suggests, it's going to extend the fingers or extend the digits. Digits 2 through 5 to be specific. We have other muscles that are not included in these tables that their primary function is to move the thumb or digit 1. And last but not least, extensor carpi ulnaris. It will extend the hand at the wrist, and it is found on the medial side of the forearm, or towards the ulna. Same thing that you've been doing. Take some time with this image now. Here we are looking at a posterior view of the forearm. Take a minute to identify the 4 muscles that we just discussed. Trace their tendons down to their insertion, or identify them on the forearm and try to make sense of their actions at the wrist joint. Again, this was chapter 10, part 3. We focused on muscles of the shoulder and the rotator cuff. Then we moved into the arm as well as the forearm.